30 years, the Boston Healthcare for the Homeless program has gone into the streets of Boston to treat our most vulnerable. It is now the largest standalone healthcare program for the homeless in the country. And our guest tonight helped found that organization back in 1985.
Dr. Jim O'Connell has been dubbed the Saint of Boston, and he joins us tonight to talk about his new memoir, Stories from the Shadows. And Dr. O'Connell, thanks for being with us. And talk a little bit about what the scope of the problem is that your organization works with every day.
Our program is designed to try to reach out to take care of homeless people wherever they are in the city of Boston. And it was started as a city program back in 1985. And the goal was to get the doctors and nurses and folks out of our clinics and out to where homeless people were, on the assumption that if we waited for them to come to us, it was too late. So we do the clinics in the shelters, most of the major shelters in town, the family and adult shelters. We have clinics at Boston Medical Center and Mass General Hospital. We also run a 104-bed sort of McGinnis House, which is a respite program for homeless people who are just too ill to be on the streets or in the shelters, but don't need to be in the hospital anymore.
You also go right into the streets and treat people there. You told an anecdote in the memoir about finding a community of people right underneath Copley Square. Can you tell us about that?
Pine Street Inn runs this remarkable outreach van every night of the year, from 9 at night till 5 in the morning. And I've been blessed to ride on that a couple nights a week. And when we do that, you learn all these remarkably mysterious places where people are. And the story I was telling in the book was we had not been aware there were about 30 people living in the tunnels under Copley Square. So where the Mass Pike goes, where Amtrak goes, and where the MBTA goes, there's a network of very kind of intriguing tunnels, and people were living down there. And I had been working for 10 years on the streets, never had a clue.
Wow. And for people who are watching, we're about to hit winter when it's very cold. I think when people pass by homeless people, they wonder what they can actually do. What is really helpful for a homeless person they encounter?
The most important thing I think you can do is to just look someone in the eye and acknowledge them. We often wonder about, do you give money or do you not give money? And those questions, I think, torture all of us. I don't know what the right answer is. Barbara McGinnis, who is a nurse who taught me everything I know back in the beginning, used to suggest that you pick one person that you can give something to, give a cup of coffee, give a Dunkin' Donuts card, and have a chat with that person, but do it consistently over time, because what is much more important is not what happens at a single episode, but the consistency and presence over time.
That makes sense. You brought your medical bag that you take out into the field. You said that you've pared it down over the years. Can you show some of the instruments that you're using?
Sure. You know, in the old days, we would bring lots of stuff. We would bring, you know, bandages and all the things that you would think of for a first aid. And we've been pretty much able to pare that down as we've had over the years. We've evolved a system of care for folks. So this is about all we carry right now. And in it are some key things. And, you know, a little embarrassing, you know, it's a stethoscope, which is very key, and we still carry that. But we've learned on the streets, the most important thing you need to know is if somebody is sick or not sick, especially in the middle of the night. So we've got, and this was done by our nurse practitioners and physician assistant many years ago. So we have a simple blood pressure cuff, which you put on the wrist. We can, you have a thermometer that you just stick in the ear and it tells you your temperature. And then there's even a little, this is a little thing called an oximeter, and you can put this on your fingertip and tell how much oxygen is. So with this little bit, without taking anybody's clothes off, you can get a lot of really vital triage information about whether people are sick or not. So these have become the mainstay, along with what I won't show you is like some Dunkin' Donuts cards and things that can win people over.
And still, you say the most important thing dealing with the homeless is not to judge.
People that you see on the streets and can't quite figure out what's going on, if you ever get the chance to get to know them over time, you'll find that most of them have remarkable stories where they've lived through unspeakable trauma, been dealt a really bad hand, but they really are living relatively courageously despite all that. I think most of us would be broken by what they lived through.
Well, it's a fantastic message. Thank you so much for what you do, Doctor. The book, again, is Stories from the Shadows. You can learn more at cbsboston.com. We'll be right back.